Hi, it's great to see everyone today. Thank you, Roberta, for the introduction. I have the honor of being here with Sarah Koske from Amref. Sarah is the Program Manager of Public Health Emergencies. And Sarah, welcome. Great to have you.
Thank you very much, Julie. Thank you, everyone.
Great. Well, what we wanted to do today, I had the great opportunity to meet Sarah earlier this year. I took a trip to Kenya in June and met Sarah and the Amref team. And we had a great trip where we traveled from seeing vaccination campaigns from the urban areas of Nairobi to more remote areas, 3 hours away from Nairobi. And we know from all of the work we've done over the last year with vaccination across the world that it's very different depending on the country, on the region, the city, and even the nuances that are different from rural areas to urban areas. So what Sarah and I would love to do today is kind of take you on the same virtual field trip that I had the opportunity to go on and understand some of the challenges and actually also some of the things that we've done really well and we can take as learnings for the future. So Sarah, first, before we start, I would just love to know a little bit, can you give us a preview of where we're going today? Maybe where we're going to start the field trip and then where we're going to end. I'd love to, to hear the names of the cities and places we're going to go.
Oh, absolutely. Thanks, Julie. And yeah, it's a shame that we can't see it in person, but I'm hoping we can paint a picture on how that looks like. So we will be starting in Nairobi. Nairobi, of course, is our capital city in Kenya, and that is also where Amref Health Africa is headquartered. And we will travel to a county that is not too far from Nairobi and yet very rural, and that is Kajiado County. So we'll move from Nairobi and then we go to Kitengela Health Center. It's a level 4 health center where all health services are actually provided. And then from there, we will now move to another, a more rural area, 1 hour away from Kitengela, where we do not have a health facility, but then we use mobile clinics to offer health services to that remote area. And we'll go further deep, 2 hours away from that to be able to get to a school. And this school, Olmerio Primary School, where we also are offering health services to pupils and the surrounding community. Because then you can imagine if someone was to move from Olmerio to Kitengela, that is almost like 3 hours to get health services. And that's why we then take the services closer to the people through outreaches, through schools, through marketplaces where we can offer these services where anyone can congregate.
Well, great. So let's start in Nairobi. When I was on the trip, we started at a hospital, a health center. So can you talk a little bit about the hospital, who receives their vaccinations there, maybe what the catchment area is? How do people even know about the vaccinations that are happening at hospital levels?
So at hospital level, it's where everybody would go for any service. So because then they know definitely they're going to get that service. So at hospital level, you will find that they are more equipped than a rural health center, for example. So at hospital, you will find all the services that are being offered. The hospitals are also the first place that were prepared to offer COVID-19 vaccinations. Because when we started to do vaccinations for COVID, not all health facilities were offering COVID-19 vaccinations because of 3 things. Number 1 was they did not have the proper cold chain. Number 2 was the healthcare workers were not trained to be able to offer this, but also there's a data management issue that was going around. And so the hospitals were the first to be prepared to be able to offer these services, but also don't forget that they also offer primary healthcare services. So any other ailment is done at the hospital. It serves more than 10,000 people, catchment population, and it serves from children to the elderly. So any service that you would want, you would get at that hospital. But unless it's a complicated situation, then they have to refer you to the national referring centers.
What were some of the biggest challenges for rolling out the COVID-19 vaccine at the hospital level?
So number 1 was the equipment, cold chain. So that was the biggest, because then at that point in time, not all facilities were really prepared to be able to store COVID-19 vaccines, as much as they still had their fridges to store their routine immunization vaccines. But then they did not have that capacity to be able to store these. And the other one was in terms of the issues of temperature monitoring. You'll find that as basic equipment like temperature monitoring equipments were missing. And so you cannot tell if the vaccines are still okay, how much have they been exposed, how can you continue to monitor the temperatures. That was a big challenge. And the other challenge at the beginning was the healthcare capacity, the health worker capacity. So number one, in terms of training, but also in terms of workload, because remember when vaccines came to Kenya and the rest of the African continent, they were very limited, and it was only restricted for healthcare workers and the elderly. Mm-hmm. And so people were actually scrambling for these vaccines. And so the workload at these hospitals was huge. And so you can imagine you have a whole queue for vaccination of COVID-19, and yet you still have another queue for your maternal child health welfare. You also have maternity, you have family planning, you have outpatient. And so the workload was also too much. And I guess we were not also prepared to be able to divide the roles to be able to see who can do what at that particular time. And so it's been a journey, but I must say things have really improved as it is now.
Great, and I think we're going to circle back to some of the improvements and changes that have happened, but let's move on actually to some of the next levels, because I would imagine the challenges just become even greater. So let's drive an hour away from the hospital, and now we're in a town.
Yes. Yeah. Yes, we are in Kimberley, somewhere in Kajiado. Kajiado is a county bordering Nairobi, but it's more rural, and also lived pastoralist communities are in this county. And so you'll find that access to healthcare facilities is very difficult. People will walk more than 3, 4, 5 kilometers to be able to get to a health facility. So you can imagine if the services are not that close, even the normal services, healthcare workers are not able to reach the community are not able to come to the health facility. And so what happens in such instances is, as Amref and partners, we put together a caravan. We go with a mobile clinic. The mobile clinic is equipped with cold chain equipment. It has Immunize. It has all the vials for immunization, not only for COVID, but also for childhood illnesses. It has medication for minor ailments, but then also you have healthcare workers who will be doing vaccination, but also treatment of other minor ailments. So this is usually makeshift. So whenever we're lucky to get our mobile clinic, then we're able to go with that mobile clinic. But that doesn't stop us, because where the mobile clinic is not available, then we actually do tents. And this is temporary for just the particular day. So what happens prior to the outreach is mobilization is done by community healthcare workers and public health extension workers. And then they are able to announce to the community that on such a particular day, there will be health workers coming to town. And so they will know where the sites will be, and they will know what services will be provided. And so to ensure that we are maximizing the healthcare workers and the facilities that we've put in place, we ensure that it's integrated so that they will come for the COVID-19 vaccination. They will still come with their children for immunization. Someone will come for NCD monitoring of their blood sugars or heart rates. And so every service is provided. Here, the healthcare workers also are able to treat the minor ailments, if it's a headache, if it's a wound, such things. But if it's anything complicated, then now they have to refer to a health facility where they can get more specialized care.
Great. And so, what is the catchment area for this? Like, how many people are coming to the mobile clinic on a certain day?
Oh, thousands. I mean, you will find like you'll get almost 500 people, for example, in Kajiado, because I told you it's a rural area, so it's really vast. But in other counties where populations are higher, you'll find thousands of people coming, because then it's it's an opportunity for them. These services are not usually there. And so when they hear that doctors will be in town, then they really purpose to come. And so for an outreach, you'll find that in a day, you'll see more than 300 people.
And then now we're going to drive maybe 2 hours on a very bumpy road, very, very less traveled, to the very remote areas. And so what does that look like?
So to a school. So you realize that in this rural county, it's a pastoralist, which I told you earlier. And the places where people converge would be schools, will be markets, will be health facilities, will be water points. And these are not usually close to each other. So schools make a very good place for service provision, for example. So we would go to a particular school, and this school, then also the communities that bring their children to this school would also come for the services. And so what happens, just like in the outreach, is the healthcare workers are also equipped with everything they need to at least provide basic care. You will have vaccination for school children for COVID-19 vaccines. And in Kenya, now we've started even vaccinating 12-year-old. For some time, we've been vaccinating only 15 and above. And so 15 years to 18 years get their vaccinations in school. But also we integrate that with HPV for 10-year-old girls and above. And so that's also done. But aside from the school community, the pupils and the teachers, we also have the community who are also coming for the services. So the school will provide maybe a classroom or under a tree somewhere, or a mobile clinic would go there. And this is where now it becomes their health facility for that particular day. And this is also done for 1 day. But prior to doing services in schools, we have to get parental consent, because now we're going to deal with minors. And so what happens is we have meetings with the head teachers prior to the vaccination day, and then the head teachers would speak with the pupils to go and get parental consent for vaccinations and any other treatment. And that is done prior to the day where the health workers go to offer services.
Thank you. And I think at all these levels, there's an element of mobilization before the service is offered. And so I have to ask a little bit about vaccine confidence, and how have you seen that evolve in the past year? Is it different at the different levels? How does Amref, what kinds of programs do you have in place to help with that?
Yes, so it's been different. So at the beginning, of course, everyone was skeptical when COVID started, and people were worried that how come we have a vaccine too soon? And we've seen vaccines being developed for years. And so that there was that skepticism. But at the same time, people were scrambling for it, because then it was a lifeline to say, if you can get the vaccine, you will be protected from the virus. And so there was those two things. And at the beginning also, because there was challenges of access to the vaccine itself. You remember we had limited in Kenya, but also in Africa. I remember even Amref, we had a campaign about vaccine equity. And so by and by, we were able to get enough vaccines in the country, and people were actually, because initially it had been restricted to be given to only healthcare workers and the elderly, because then they were the most susceptible at that particular time. But then as the more vaccines came into the country, that was expanded and everyone was able to get. And so the biggest challenge was access at the beginning. And so these mobile outreaches enabled us to break the access barriers. So the fact that someone will not take a vaccine because then they'll have to travel kilometers to be able to access it was then catered for. So the outreaches it's been very useful, because whenever communities hear that there's an outreach offering COVID-19 vaccines, they would actually come for it. Where we're seeing a bit of hesitancy is among the university students, the 20-year-old to 25, 25-year-old to 35, then that is where we see a lot of hesitancy. And so what we've done as Amref is to improve our risk communication and community engagement through mass media. We've done digital media, especially targeting now this cohort that is not taking the vaccines, but also using local vernacular radio for the communities where the elderly people actually have high listenership for this vernacular radio, and so they're able to get the information. It's demystified if there's any miscommunication happening, and they are able to come for the vaccine. We also use this to announce when the next outreach is happening. So they would know that it was announced on the radio that there will be an outreach in facility X, for example, and the next day they would be coming for those services.
Thank you. And I know you've done a lot with digital, with Facebook and TikTok and other digital media, especially to target that age group too.
Yes.
So just flipping a little bit, I know that's been incredibly interesting to see what the past year has looked like. What do you see as some of the, like, how does it look for the rest of 2022 and forward? Are you still focusing on integration? How have you seen integration with other health services evolve? Do you see challenges there?
So integration is the way to go for sure. And if we are to reach the last mile, we cannot do siloed programming. We cannot only go with one vaccine and lose the chance where we've taken a whole crew of healthcare workers to a village kilometers away and then just give one service. I think that is not prudent use of resources. And what Amref has been doing is making sure that all our outreaches, all our services are integrated. And so when you put out a team of healthcare workers to go to use the mobile clinic to go to a village, then they are going to offer comprehensive services. The only service they may not offer at that particular time is anything complicated that needs to be done in a health facility setting. But anything on primary health care, family planning, maternal child health services, non-communicable disease screening, treatment of minor illnesses is actually done. And so even the communities themselves expect that, because then they when they hear there's doctors in the village, then they know they're going to get all the services that they require. And so we cannot continue to mobilize communities and yet not offer the service. So we have to match the demand with the supply. And so the Amref and county governments are working together to make sure that these mobile clinics are well equipped. The healthcare workers are well prepared to be able to tackle this at the community, the last mile for sure.
And then I think lastly, I think what we're all interested in here, especially at this conference, is where are the opportunities to partner? So where do you see as private sector, whether it be the NGOs or corporations or foundations, you know, where can we partner and help even more people get vaccinated?
Absolutely. There are many areas where we can definitely collaborate. And the first one, of course, is there's no healthcare without healthcare workers. And so the health workforce, strengthening their capacity, training of healthcare workers is something that needs to be supported to make sure that we are always prepared to be able to offer the services that is required. The other thing is building the health system's resilience. And this goes just beyond the healthcare workers. There is the issues of cold chain, but also the issues of the health system in general, in terms of the governance, in terms of equipment, and also in terms of the leadership for that health facility, so that they are able to serve communities with the pandemic or without, so that the community is being served all day, every day, and they are able to get the services that they require. The other thing is using this data for decision making. So because then facilities offer a range of services every day. And so if we are then to improve that health system, then we need to use the data. We need to use the epidemiologic data also that we get from that health facility to be able to make decisions to serve the communities better. And also the private sector health facilities, in as much as for Kenya, it's pay for service, and I think this is common for every country. But there are services that they actually offer, and the community does not need to pay out of pocket, like COVID-19 vaccination. So awareness creation for communities that there are services that you can still go there and get is important. And I think there's also something around the National Health Insurance Fund being used to offer primary health care, even in these private facilities.
Thank you so much, Sarah. And first, I just want to say incredible work Amref is doing across all of the regions, to ensure vaccine equity, and that, people not only get vaccinations, but also these primary health services that are just as important. I just want to thank you for taking time today. I know you're in the field right now and quite busy, so thanks again. And I feel like I'm excited for more partnership, and hopefully this opens up some more opportunities.
Absolutely. Thank you. Thank you, Julie. Thank you. And whenever you have a chance, come to Kenya, you'll see firsthand how these lives are being changed, for sure.
Thank you.